Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll discuss about the parts of the stomach. So stomach has two parts, which is cardiac and pyloric. So by a line drawn downwards and to the left from cardiac and to the angular notch, the line is extended further to the greater curvature. So the larger cardiac part is further divided into fundus and body, and smaller pyloric part is subdivided into pyloric antrum and pyloric anal. So first part is cardiac part. So the fundus of the stomach is the upper convex dome-shaped part situated above a horizontal line drawn at the level of cardiac orifice. It is a commonly distended with gas which is seen clearly in the radiographical examination under the left dome of the diaphragm. And the body of stomach lies between the fundus and pyloric. And it can be distended involves along the greater curvature. And the gastric gland disturbed in the fundus and the body of the stomach contain the all three type of the secretory cells. First is mucus cell, second is the chief cells, peptic or gynosomatic cell, third is the HCl secretive cells, that is gastric juice secretion from the gastric gland. Next part is the pyloric part. So the pyloric antrum is separated from the pyloric canal by an inconstant sulcus intermedius present on the greater curvature. It is about 7.5 centimeter long. The pyloric gland are richest in mucous cell. Second, the pyloric canal is about 2.5 centimeter long and it is narrow and the tubular. Next are the relation of the stomach. First are the peritoneal relation. So the stomach is lined by the peritoneum on both its surfaces. At the lesser curvature, the layer of peritoneum lining the anterior and posterior surface meet and becomes continuous with the lesser omentum. Along the greater of the curvature, the layer meets to form the greater omentum. So this figure shows the lesser omentum, which is a hepatogastric part, and lesser omentum, which is the hepatoduodenal part. And near the fundus, the two layers meet to form the gastrosplenic ligament. And near the cardiac end, the peritoneum on the posterior surface is reflected onto the diaphragm as the gastrophrenic ligament. And the greater and lesser curvature along the peritoneal reflection curvature. Next are the visceral relationships. So the anterior surface of the stomach is related to the liver, diaphragm and the anterior abdominal wall. And the diaphragm separates the stomach from left pleura, the pericardium and the 6th to 9th ribs. And space between the left costal margin and the lower edge of the left lung on the stomach is known as trabea area. And the costal cartilage are separated from the stomach by transverse abdominis muscle, and gastric nerves and vessels ramify deep to the peritoneum. So normally on percussion there is a resonant note over this space, but in splenomegaly or pleural effusion a dull note is felt at this site. Thank you.